Hi, our project is Bioscope Technologies, a medical technology designed by Rishang Saini and Adi Swaro. The problem that Bioscope tackles is healthcare accessibility in rural areas. We will visualize the problem through an example. Let's begin.
This is Al. Al loves his body. He treats it like a temple. Recently, Al has been snoring in his sleep, sweating more than usual, and his breathing rate has gotten abnormally high. Although his wife is slightly annoyed by the unusual snoring, she doesn't feel it is worth it to travel 2 hours to the nearest doctor to get a check. As Al and his wife prepare for their morning walk, they are both unaware of these subtle changes that are actually signs that Al is on the brink of a fatal heart attack.
19.3% of the human population lives in rural areas, according to National Master. This is a significant amount. Some rural areas have characteristics that put residents at higher risk of death, such as long travel distances to specialty and emergency care or exposures to specific environmental hazards. Rural Canadians tend to have higher rates of cigarette smoking, high blood pressure, and obesity. Rural residents report less leisure time, physical activity, and lower seatbelt use than their urban counterparts. They also have higher rates of poverty, less access to healthcare, and are less likely to have health insurance. All of these factors can lead to poor health outcomes. Children in rural areas face challenges.
Al wears the Bioscope device somewhere on his body where it contacts his skin. The device combines previously researched detection technologies such as the 3-axis accelerometer, optical heart rate sensor, and noise level charts to track physiological data in his day-to-day life. This data is sent to our app, which uses unsupervised machine learning models to analyze patterns. These models are complex and difficult to decipher for Al, so our app summarizes these patterns and displays simple health information in a way he can understand. This information may include high stress levels, lack of sleep, or malnutrition. If the model detects irregular stress levels, it will give Al a message on what he can do in response. If the machine learning model detects more significant abnormalities in these patterns, complex data will also be sent to his doctor. This could include blood pressure, noise level charts to analyze sleep, and ECGs to analyze breathing patterns. The app will then inform the doctor about these abnormalities, and the doctor can then perform his own analysis. We designed this entire system to solve one problem: accessibility. Bioscope not only acts as a remote clinic, but it allows for live physiological monitoring at rates we haven't seen before. This is because Bioscope approaches the wearable technology field through a new perspective: unsupervised machine learning. Unsupervised machine learning can detect patterns within data without any input. While a doctor may be able to call a patient to assess them remotely, they cannot collect any data or do a proper physical checkup over the phone. Bioscope addresses this problem by having a constant live monitor that saves the time of both the doctor and the patient by streamlining the information collecting process.
An ethical concern with Bioscope is confidentiality and encryption when sending this information. Sending information through the internet poses a risk for cyber attacks. This becomes a concern when you send patient data, as it poses a risk for confidentiality. While this will always be a concern, current encryption methods work with a high degree of security and are difficult to crack. An economical concern that arises with Bioscope is that accessibility isn't limited to geographical location. Wearable technology can be expensive for some demographics. This is a big concern for us, as we don't want one of our solutions to healthcare accessibility to also lead to a problem with accessibility. We predict that, just like other technology, the price of Bioscope will reduce over time. And as Bioscope technologies become better researched, they will be more affordable with time. Our last concern is a social one. It may be difficult to implement Bioscope because many healthcare professionals think that models like this are made to replace primary care physicians. Our model would not replace physicians, but instead be their assistant. It cannot and won't diagnose anything to the patient.
It is in scenarios like Al's where Bioscope can make impactful change. People like Al are in need of a medical safety net. They make poor decisions about their health because of an external factor, in this case, accessibility. Bioscope will safely and accurately help make these decisions for them.